Hi friends, this is Dr. Apurv Mehra and I'm really excited to meet you with Dr. Shailesh Pai, Dr. Faheem, Dr. Vishal and the entire team of Conceptual Orthopedics to take you to the Pinnacle course. They are developing it to the next level. Let me show you what they have in store on 21st to 23rd of February at Greater Noida Vidya Jeevan Center for you. CO team is ready. Dr. Shailesh has put in his heart and soul to make it a success. The response is phenomenal. We have just 9 seats left and we are going to close anytime. We are going to have 72 young orthopedic surgeons learning the Pinnacle Trauma course. They are going to have hands-on experience with instruments, implants, sawbones which have been imported for you so that each one of you goes as the best version of you. Let's have a look what we will do on those 3 days in the Pinnacle course in Delhi, in Greater Noida. Day 1. We will welcome you right at 8:30. We'll have the inauguration. Then we will have a session 1 on proximal humerus. For those who are not aware, let me tell you, the Tejaswini Hospital, where Dr. Shailesh Pai is the trauma head, and that hospital has been beautifully built and maintained by Professor Shantaram Shetty sir and Professor Ajit sir, right? He has got maximum number of cases of proximal humerus nailing in this country, probably highest in the world. That person is going to teach you the art of proximal humerus fixation. Now this is what is Pinnacle course for you. So we have nothing less than the best. It is for you to try to imbibe like a sponge and take away the maximum yield from here. Then we'll have a coffee break. The coffee and food will be there the whole time for you to enjoy. Then after that, we will have simulation and advanced training. So this is something which is new and we will teach you how to understand and how to have a look of these fixations. Next, we'll have a lunch break. After that, we'll have lag position and compression plating. A part of it was covered in our basic course and now the foundation course, and now the Pinnacle course is going to take up a notch higher on this principle. Then session 2 will be about the distal humerus, all right? Then again a break, and then you'll have an exercise on tension band wiring. So we have got specific tables made, we will have specific models, and on them you will practice. So this is for each one of you to understand the correct principles, and we know that the significance of doing a TBW, the lag screws, the compression platings or the proximal humerus is so important. Then onwards we'll have session 3, we'll have discussion on forearm, elbow to wrist, right? And then we have given on day 1 a time period for you people to get your own cases and you can discuss with the team there so that you go better educated and how you should have handled that case or how you actually did. Many a time you will see that you've been doing okay. So you will have a stamp on what you have done. Many a time as we orthopedic surgeons are criticizing so that we learn more. All right, this is what we're going to do. Day 2. Now day 2 is going to talk about the proximal femur. We will have an exercise on dynamic hip screw, distal femur, an exercise on bridge plating, proximal tibia, exercise on medial buttress, section 7, ankle and pylon, and then we will talk about external fixator. Imagine, if you don't know external fixators, can you do arthroplasties? Robotic arthroplasties you can't do. So everything, comes in hand in glove. You are developing an orthopedic surgeon, you can't ignore trauma. You need to be a master of it. So why not to learn from the best masters? And this is what the Pinnacle course gets you. So imagine, at one end, we are training you with DHS, we are training you with platings. At the other end, we are training you with tension band wiring and fixators. So it covers the entire spectrum. And then comes day 3. Day 3, we talk about something which is very, very important. We will start every day with a recap. We will have non-union. We will have implantology. We will talk about discussions with cases, what went wrong in particular cases. This is a session which everybody loves even in the foundation course. Then we will have periprosthetic fracture and pediatric trauma, and something which we have a specific team coming, right, to tell you about the implant removal. If you ask me at this stage, which is the most difficult trauma case, where you can't guarantee your time, that's going to be implant removal. So we will be showing you some certain implants and instruments which you would not have seen actually, right? And this is going to be a huge thing, right? And then we have a session on proximal tibia, then we have lunch. What I will request is, do not be in a hurry to leave on the 3rd day. Stay with your teachers, have a good discussion, right? Each day, right? Make them tired, exhaust them, bombard them with questions. But for that, you have to be ready with it. So read and come is the rule. Come here, interact more, do more, clear your doubts, because if not now, then when? So let's meet on 21st, 22nd and 23rd. Calling you, inviting you, waiting to welcome you for Pinnacle course. And thank you very much from the entire team of Conceptual Orthopedics for the very, very warm and hot response you have given to it. Thank you very much.